Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. What are the investigations that are performed to diagnose male infertility? How do we arrive at a conclusion when we are treating a couple? Because it's very important to understand that when a couple arrives for treatment for not being able to conceive, both the parties are investigated. The woman is definitely investigated and there is a guideline to do that, but males are also investigated thoroughly. The first and foremost thing is medical and physical examination. This involves getting to understand whether any previous surgeries have occurred, what is the history of the patient, have they fathered children from previous marriages, or do they have any medical conditions, thyroid, diabetes, overweight. All these things come under medical and physical examination. In addition to this, in fact, the most important aspect of male investigation is semen analysis. Under semen analysis, we look at a lot of aspects. We look at the volume, we look at the concentration of sperms, the motility of sperms, morphology, the shape of sperms, etc. All these give a fairly good idea about sperm production in testis. When the sperm production is low, then the count is low in the semen analysis. When there is a problem with the quality of sperm production, then the motility and morphology also is low. Not just this, the volume also could be low and could give us a lot of information about the functioning of seminal vesicles and prostate. So quite a lot is deduced from semen analysis. It's very important to perform this test as well. Next is hormone testing. Now, there are a lot of hormones that are at play for proper sperm production, such as testosterone, follicle stimulating hormone, luteinizing hormone, prolactin, thyroid. All these tests are investigated. When we look at the results of these tests, we try to understand if something is not according to the range, which should be according to the age of the patient, and based on that, treatment is provided. Genetic testing is another important aspect. We perform something called as karyotyping. This gives us a fair picture of the chromosomal content in your body. So if there are any chromosomes that are duplicated, if there are any chromosomes missing, if there is a part of a chromosome missing, if there is an inversion in the chromosome, all these are inferred from genetic karyotyping of the patient, and this is a very important aspect when we are trying to especially look at patients that have low count, that have poor morphology or poor motility as well. There are some specialized tests like DNA fragmentation tests. Now these are performed in patients that have had previous failure, do not have a good count motility, do not have proper production. All these are very important things that point a finger at maybe the DNA fragmentation is low, especially in patients that have had previous treatment failures, previous IVF failures, previous poor embryo formation during IVF. All these are indications of a poor DNA index. Therefore, this is also performed to evaluate male fertility. Scrotal ultrasound also is an important investigation. This gives us an idea whether varicocele is present, which is causing the problems which are evaluated in semen analysis. So, scrotal ultrasound also gives us a fair idea about whether proper blood flow is present to the testis or not. When all these results are put together, or some are done and put forward, the reproductive urologist or fertility specialist will be able to better diagnose the problem and give you a solution for the issue. If you want to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.